Should you get a fecal calprotectin test for IBD? Imagine being unsure whether your stomach issues are just a sensitive gut or something more serious. That's where a fecal calprotectin test can come into play. If you're experiencing ongoing diarrhea, abdominal pain, or blood in your stool, your doctor might suggest this test to help figure out what's going on. It's a simple, non-invasive way to check for inflammation in your intestines. The test measures calprotectin, a protein found in white blood cells. When there's inflammation in your intestines, white blood cells releases more calprotectin into your stool. So, high levels can point to inflammatory bowel disease, which includes conditions like Crohn's disease and ulcerative colitis. On the other hand, low levels usually mean there isn't significant inflammation, making conditions like Irritable Bowel Syndrome less likely. This test is especially helpful because it can tell the difference between a functional problem, like IBS, and an inflammatory condition. It's quick and cost-effective, often used in primary care settings to decide if further testing is needed. If your results are normal, it can reassure you and your doctor that you probably don't have inflammatory bowel disease. That might mean avoiding more invasive procedures like a colonoscopy. However, if your calprotectin levels are high, your doctor will likely recommend additional tests, such as an endoscopy, to confirm the diagnosis. Keep in mind that elevated calprotectin can also occur with infections or other inflammatory conditions, so it's not a definitive diagnosis on its own. It's a helpful piece of the puzzle, but not the final answer. Getting this test makes sense if you have persistent symptoms that could be IBD. It helps your doctor decide whether to start treatment or do more detailed testing. For people with sensitive stomachs or symptoms that seem like IBS, it can be a way to check if inflammation is involved. Normal results can bring peace of mind, while high results guide you toward the right diagnosis and care. In short, if your symptoms point toward possible IBD, asking your doctor about a fecal calprotectin test is a smart move. It's a simple, effective way to help clarify what's causing your symptoms and plan the next steps in your health journey.